I would now like to invite our next speaker, Dr. Shyam Aggarwal. Dr. Shyam Aggarwal is a cancer specialist specializing in medical oncology, having more than 3 decades of clinical experience. He's a senior consultant at Sir Gangaram Hospital, New Delhi. He completed his MBBS from Chandigarh and then MD Medicine from PGI Rohtak, after which he underwent a special training in AIIMS, Delhi. Having a special interest in bone marrow transplant, he underwent training at University of California, Los Angeles, and St. Vincent Hospital in Sydney. Being a renowned oncologist, Dr. Aggarwal has been honored with many awards and recognition throughout his long, illustrious career and has been involved actively in creating awareness program for bone marrow transplant and colon cancer. He has many publications in national and international journals. I now invite Dr. Aggarwal for his talk.
Yeah, thank you, Dr. Anisha. So I think this is a relatively new field for all of us, although we are using a couple of drugs, but the understanding of epigenetics for a medical oncologist, as Ashish and the previous speakers have done, is not all that great because it's a little neglected field, you know, for as far as we are concerned in terms of getting to the basics of epigenetics. So you gave us this opportunity. Thank you very much. So I thought I'll cover immunotherapy and the role of EZ-H2 alterations in cancer. So these are a few slides. I'm sure everybody is aware of these. So this is basically the, I think you understand DNA methylation, whether there is loss of repeat region or there is hypermethylation in the DNA that can result in a variety of cancers. So hypo as well as hyper. The DNA methyl transferases are the ones which are responsible, but you know, for maintaining the methylation. But the mutations in the DNMT3A and TET enzymes, you know, can result in loss of function and cancer. The other aspect, as you all know, is histone acetylation and deacetylation. Because it is responsible for chromatin structure, transcription, and DNA repair. And the other third thing is the containing proteins, which is the acetylated histone, and these are epigenetic reader proteins, and they could result in you know, a progression for gene abnormalities, and also reported in the breast cancer, breast cell cancer, and melanoma. So I'll just come to the immunotherapy part. I think when you look at the immunotherapy, the histone methylation is important, which is done through HMTs, while HDMs, which are histone demethylases, they are important for maintaining the methylation pattern of the histones. And EZ-H2 and SET are two important you know, enzymes which are related to immune mechanisms as well as occurrence of cancers, particularly lymphoma, as I will come to. And the trimethylation is an important tool, you know, which is for EZ-H2 understanding. I think Dr. Ashish also mentioned about lysine methyltransferase DOT1L1, which is being developed for you know, cancer control. So this is the you know, a diagram to show the histones H3, H4, and as you see here, the K27 you know, methylation is the one which is what we're going to refer to when it comes to EZ-H2. So lysine methylation of histone 3 at amino acid residue 4, H3K4, is and similarly, you know, at 3679. But I think when you come to 27, that is where the EZ-H2 you know, enzyme is involved. So loss or gain of HMT or HTM activity result in mutations, deletion, amplification, and that could be linked to the occurrence of malignancies and their evolution. So again, I think, as I mentioned before, the fifth is the microRNA's role, which is another epigenetic marker in a variety of cancers, especially through the immune mechanisms like microenvironment, and immune checkpoints. So the point is that the epigenetic pathways are involved in the regulation of immune checkpoints and tumor microenvironment, which become abnormal, and therefore the tumor cell kill is not achieved. So I think this is in a nutshell about the chromatin and the histone tail methylation and histone tail acetylation and the DNA methylation and the BRD. So, this is sort of a summary, and you see EZ-H2 will come at the HMTs. I'll come to that. So these are, various hypermethylation of CpG islands, and a variety of cancers can have a variety of abnormalities which have been documented. I'll not go into the details of this. So suffice it to say that in cancer, not only the hypermethylation or hypermethylation, both can play a role. So you really need to understand these mechanisms much more clearly and much more easily, so as to develop these as targets, as you will see in EZ-H2. So just to share, since my talk is on immunotherapies, so these are a large number of trials where you can see the histone deacetylase inhibitors or immunotherapeutic, a drug like Nivo, Pembro, Tizo, etc. DNA methyl transferase inhibitors with these combinations. So you see, these are phase 2 trials going on. As such, I don't think we have any established protocol or any NCCN guidelines, but work is going on at this point in time. Similarly, you can see the EZ-H2 and the multiple combinations of various other drugs like, azacitidine or entinostat with various immune checkpoint inhibitors in a variety of cancers. And as you can see, these are phase 1 or phase 2 studies ongoing. So, the work is on at this point in time. Similarly, you can see in a variety of common cancers, you have, these agents of immunotherapy and other drugs, which are the epigenetic markers being tried, which is epigenetic therapies, which may synergize with immunotherapy. So, you see here, the immune or the inflammatory related gene signatures were increased upon inhibition of epigenetic mechanisms. So this is one finding which has emerged, and therefore epigenetic mechanisms are a target for improving the inflammatory signature or immune signatures to kill the tumor cell. And early clinical studies have been shown when they combine PD-1 or PD-L1 immune checkpoint inhibitors with the HDAC inhibitors or DNA methyl transferase inhibitors to improve the responses, which I'll just share a few slides in that direction. So the idea is to improve upon the PD-1 or PD-L1 checkpoint inhibitor responses. And this is done through enhancing antigenicity and presentation of tumor-associated antigens, reprogramming of the tumor microenvironment, and reversing the cytotoxic T cell exhaustion. So, so therefore a lot of basic science is currently people are trying to understand so as to add on to the PD-L1 or PD-1 inhibitors, these epigenetic drugs. So I think these are various, so not only the PD-L1, or you're trying to address the immune cells, you're trying to address the microenvironment and trying to address the cancer cells by a variety of epigenetic drugs. So this is the cartoon to show, which I was just showing, that you want to improve the CD8 positive T cells, the activation, the presentation of the antigens to the lymphocytes, and then to improve upon these various cytokines by way of these epigenetic drugs. So I know there's a lot of theory here, but I think this is basic research at this point in time. So the DNA hypomethylation agents can synergize with immunotherapy by, as I said, improving the presentation of the MHC class 1 genes. There have been studies in lung cancer cell lines that 5-azacitidine treatment upregulates the JAK-STAT pathway, and decitabine not only affect tumor cells, but may also have direct effect on the CD8 positive T cells, which are the cytotoxic T cells. So there is a role for these epigenetic drugs to improve the immune functioning so as to kill the tumor cells. This is a second generation DNA, inhibitor, methyltransferase inhibitor with ipilimumab, which is against metastatic melanoma, and there are promising results here. Again, as was mentioned before, the T cell responses were increased after treatment with the NY-ESO epitope, leading to a favorable response rate of 60% in epithelial ovarian cancer. So similarly, histone deacetylase inhibitors, they also promote immunotherapy, a favorable microenvironment, and it has been shown in melanoma model for HDAC6 inhibitor. There are phase 1 studies consolidating the thought of PD-1 antibody pembro with vorinostat, and I think Dr. Bakshi showed that slide that there is an improvement in the response rate. Similar results are there with other drugs like anitinostat with pembrolizumab in colorectal and lung cancer. So now coming to the EZ2 inhibitor, there are, this is a histone methylation, promotes tumor immunogenicity, and the EZ2 inhibitor acts there. So this is a polycomb repressive complex, PRC2 complex mediated epigenetic silencing is a key mechanism for facilitating immune evasion of by the tumor cells. And repressing MHC class 1 antigen presentation pathway is addressed by the PRC2 pathway. So treatment of cancer cells by EZ-H2 inhibitor promotes antigen-specific T cell killing in vitro and disruption of EZ2 in mice models, leading to re-establishment of T cell mediated anti-tumor cell response. So there is enough data, and that is the reason of success for EZ2 inhibitors. So as I said, this is the EZ-H2 is a catalytic component of the polycomb repressive complex 2 that trimethylates H3K27 and is associated with a lot of chromatid compaction and transcription repression. And as I told you before, that it has a role in the immune mechanisms as well. So the activating mutations of EZ-H2 are found in germinal center of the lymphocyte, which results in the DLBCL and follicular lymphoma, and not only that, even in thyroid and other tumors. So there are activations and there are mutations, which I'll just share with you. In addition, in MDS also, there is deletion of EZ2 enzyme. So EZ2 can have either an oncogenic or a tumor suppressor function, depending upon the cellular context. So this is how, this is a cartoon to show that how EZ2 inhibitors are coming in the way of controlling of cancer cells by decreasing the Tregs, by improving the NK cells, or by collaborating with PD-1 and PD-L1 pathway. So this is a slide to show that EZ-H2 acts in different ways, as I just explained to you, and through the immune mechanisms. And tezimetostat and pembrolizumab. Tezimetostat is nothing but an approved EZ2 inhibitor drug, and it is effective in a variety of cancers. So HMTs, as you see, EZ2 here is important in various cancers, as I told you, especially in lymphomas, NHL, and INI1 is responsible for epithelioid sarcoma, as I will come to. And these are other, lysine methyltransferases, where you can see the association between a variety of cancers. And arginine methyltransferases are responsible for their role in another variety of cancers. So, this is evolving science at this point in time. And there are drugs now being developed, as Ashish told, against various of these, epigenetic markers. And SE2D2 inhibitor is also being developed. So you can see here the alteration of EZ2 in synovial sarcoma, in lymphomas, follicular and DLBCL, and you can see in rhabdoid tumors. So it is a marker if you can identify for using the EZ2 inhibitors. So I'll skip this slide because this is I just wanted to show the polycom and the role of EZ2 and other HDAC inhibitors. So this is an enzyme, or the gene is located on the chromosome 7, and the next slide will show you. I'll skip this slide. So you can see the dysfunction in a variety of cancers or lymphomas for EZ2 and BCL6. Again, as I told you, the SE2 domain is also responsible for occurrence of a variety of cancers. So you can see mutations in the EZ2 are responsible for development of non-Hodgkin's lymphomas. And it is important to understand that 22% of DLBCLs GCB type, that is the germinal center B type, because it is there, the EZ2 is only in the GCB type, not in the ABC type, which is the activated B cell, or in the follicular lymphoma type. So, you really need to identify this target so as to get the best out of the EZ2H inhibitors. So I think not only, as I told you, lymphomas, but there are myeloid neoplasms like MDS, 10 to 13%, who can have EZ-H2 mutations, myelofibrosis, and myelodysplastic syndromes. So a variety of hematologic malignancies have an association with EZ2. 21% of GCB type lymphoma, DLBCL, and 7.2% of follicular lymphoma. So I'll skip these these slides in the interest of time, just to showcase that the EZ-H2 mutations have a close association with a non-Hodgkin's lymphoma. And you can have EZ-H2 mutation, and you can have an overexpression as well, which could result in the development of lymphoma. So there is a balance between transcriptional repression and transcriptional activation through EZ-H2 and various other genes. So I think I'll just come to the slide where we show you that when tazemetostat was used in patients of follicular lymphomas, you see a response rate of 69%, and these are heavily pretreated patients. And even in wild type, maybe these patients have overexpression. Response rate is 35%, and the progression-free survival is not bad, nearly a year. And these drugs, if you see here, the side effect profile is fairly well tolerated. And this is a Lancet Oncology 2020 paper. So, EZ-H2 is an important enzyme to be targeted in patients with follicular lymphoma who've been heavily pretreated. And this is to showcase the combination of EZ-H2 with immunotherapy or CAR T cells. And you can see the functioning of CD8 cells, in lymphomas, which are especially, cold, or there is an increased recruitment of CD4, CD8 cells into lymphomas when they are treated with the inhibitor, which is the EZ2. So the point is that it is acting through the immune mechanisms, and it also enhances the activity of CAR T cells. So there is a close association of immunotherapy and the epigenetic inhibitors, particularly EZ-H2 here. So as I told you, the drug is also approved in epithelioid sarcomas, and you can see an overall response rate of 15%. And it's a category 2A recommendation. So the other tumors are also being addressed. For example, this is the metastatic castrate-resistant prostate cancer, and there are trials going on with the EZ-H2 inhibitor. So I think there are some studies which have shown the benefit with a drug like, I think enzalutamide has been combined with this. You can see the response rate here in patients with CRPC, which is the cross. I think Ashish was mentioning about the ARV7 patients. And again, these are the studies where enzalutamide is combined with tazemetostat, which is the EZ-H2 inhibitor. So I think there is data which is evolving in favor of EZ-H2 inhibitors in a variety of cancers, and it is approved in non-Hodgkin's lymphoma. So I think I'll just end with conclusions that epigenetics has a clear role in cancer development and the evolution, and for the phenotypic pattern of a variety of cancers. So immune cells and tumor microenvironment are controlled by epigenetics. I think there is ample evidence to that. We need to understand that much more. Modification or controlling epigenetics when combined with other agents, especially immune modulators, as I showed you, and along with other drugs like chemotherapy or drugs like enzalutamide, etc., can result in beneficial outcome for cancer control. And you have the approval of EZ-H2 inhibitor in epithelioid sarcoma and follicular lymphomas. But I think the need of the hour is to develop tests with which we can identify these epigenetic alterations more easily, so as to use these drugs more effectively to control the tumor. So I think if you can develop these tests, like we have NGS now for oncogene identifications, if we can develop these tests more easily with much more ease, I think these drugs which we are developing now to target the epigenetic machinery will be much more effective, because the target, when identified, you will have a much better outcome. So with this, I think I stop here, and thank you very much for this opportunity for us to understand the epigenetics and the role in cancer management along with immunotherapy. Thank you very much.
Thank you, sir. Thank you so much for such an illuminating talk. I'm sure we and all our audience have benefited a lot from your talk. We thank you on behalf of CAHO. Thank you so much, sir.